everyone. Sheryl Wilson, registered nurse here for S. Wilson Educators, and today I'm going to be talking to my pink sisters, those of you who have gotten the diagnosis of breast cancer. Now, once you get this diagnosis, they're going to start doing a lot of tests on you to start to determine what is the best treatment plan for you. And one of the things that they're going to do is test your tumor size and your lymph node involvement in order to get a stage of breast cancer. Now, a lot of women will be very confused of how they stage you, so I'm going to help you understand this a little bit better. This is a simplified way to understand the staging system of breast cancer. Please refer to your doctor about the categories that are not included in this video, and your doctor or institution staging system may vary somewhat for this one, so it's just a reason to start understanding how they get this information. But first, let's talk about the size of your tumor. Millimeters is smaller than centimeters, so if you get on your report that your tumor is in the millimeter category, that's very, very small. For example, this little P right here is 8 millimeters. This marble, however, now has stepped out of the realm of millimeters and goes on to be centimeters. This is 1.5 centimeters. Golf ball, 4.27 centimeters, 5 centimeters, 6.54 centimeters for a tennis ball. So this is going to help you understand a little bit about this. Okay, so let's talk first of all, there's 5 different stages of breast cancer: 0, 1, 2, 3, and 4. They do, however, break these down into subcategories, some of which I'm going to talk about today. There is stage 0. Stage 0, first of all, is referred to as ductal carcinoma in situ, DCIS, or lobular carcinoma in situ, LCIS. And it simply means, if it's in the ducts or the lobes, carcinoma means cancer, and in situ translates into in place. And it's the only cancer that is in place, meaning non-invasive. All the rest are invasive breast cancers. Okay, so if somebody gets stage 0 breast cancer, a lot of times they're confused that the doctor is recommending a mastectomy, removal of all the breast tissue, instead of a lumpectomy, removing the lump and the surrounding tissue, which is recommended a lot of times in stage 1. And they don't understand why. Figure, well, 0 is less than 1. Well, here's the reason why. Stage 1 is a very small tumor, and a lot of times the doctor can go in, take that tumor out, take the surrounding tissue out, and get what they call clear margins, meaning that they've gotten all the cancer. And it's easy to do, and then you go on to get radiation, sometimes chemo too, but radiation for sure. Stage 0, however, is different in the regards of, if you look at stage 0 on a mammogram, a lot of times there are tiny little dots scattered throughout the breast. It makes it difficult for a doctor to go in and pluck all of these tiny little dots out. So a mastectomy a lot of times is recommended to take all the breast tissue out in order to get a better chance of getting all these little specks. So that's the difference there. So stage 0, non-invasive, no lymph node involvement. The next stage is stage 1A. I told you a little while ago that this is 1.5 centimeters. Now, stage 1A is up to 2 centimeters, so slightly bigger than that, and it has no lymph node involvement. When we move on to stage 1B, again, it's less than the size of 2 centimeters, but they see a little something going on in a little group of cells. Let's go on to 2A. 2A, again, very small, less than 2 centimeters, but now you've got some lymph nodes involved, or greater than 2 centimeters, but less than 5, with no lymph node involvement. That's 2A. 2B, greater than the 2 centimeters, less than the 5, but now we have 1 to 3 lymph nodes involved. Or greater than 5 with no lymph nodes involved. That's your 2B stage. 3A, greater than 5 with 1 to 3 lymph nodes involved. 3B, any size tumor, but now the difference in this one is it is spread to your chest wall or your lymph nodes near your breastbone. Also up to 9 lymph nodes involved. Or inflammatory breast cancer. Now this is a rare one. And if you hear them say that you have inflammatory breast cancer, well then it's always going to be categorized in this 3B stage. 3C, any size, but it's spread to the chest wall and or the skin, and there's greater than 10 lymph nodes involved. And it's spread to the lymph nodes near the collarbone or the breastbone. Stage 4, this one's very different. It can be any size tumor, but what makes this one different is it has gone to a different organ, a bone, liver, lungs, brain. It is metastasized is the word you will hear. And this one is treated completely differently because not only are they treating breast cancer, they're also treating the cancer in these other areas of your body. Okay, so staging is one way that they're going to evaluate how they're going to treat you. So another thing that they're going to do now is they're going to grade your tumor cells. They're going to look at them under the microscope and they're going to see what they look like. In grade 1, your cancer cells, even though they look like cancer cells, they look still a lot like normal. Grade 2, however, they're starting to change a little more and they're starting to look more like cancer cells than normal. And in grade 3, they don't look like normal cells at all. They all look like cancer cells. So this is just another area that they're going to use to determine your treatment plan. Now do know that there are a lot more things that they're going to check. They're going to be checking for to see if your tumor is being fed by estrogen. Is it being fed by progesterone? Is it do they have a protein involved in this that's overstimulating things? Called HER2. Is this negative or positive? There are some things called Ki-67, a percentage of that. There are all different things that they're going to take into consideration altogether in order to come up with the best treatment plan for you. So don't be upset if you find someone out there that is the same stage of breast cancer as you and being treated completely different, because all these factors have to be weighed in order to get the best treatment plan for you. Now, if you've enjoyed this video, please press that subscribe button, that little bell down there, and also press that like button. This keeps me motivated to making more videos of this nature, and that subscribe button is going to allow me to notify you when I put out a new video, which I will continue to do over time. Thank you all for watching. Sheryl Wilson, registered nurse for S. Wilson Educators. Bye-bye.